Is it possible to do retransplant if we have already done one transplant from the safe donor zone? Yes, it is possible. Even after extraction of 4,000 grafts from the safe donor zone, we can re-extract more grafts by a combination technique of strip and FUE. Let's see how. So we had done transplant 2 years back for this patient, and what we did, cover the frontal area, mid-scalp and little bit of the vertex 2 years back. So we take care of giving a very natural looking hairline and a widow's peak in the central area. So now we see the donor in the close look. But you see the scar here, very minimal linear scar, trichophytic closure result. That is the advantage of the trichophytic closure technique. The hair grows from that scar again, so we can't see it properly. Now we see the laxity. Laxity is again regained. So this is how the strip works. The laxity is regained and we can reharvest a strip again. FUE was done with minimal extraction of around 1000 grafts. We are not seeing any density depletion here because we have taken less number of grafts by FUE. And the most important part, we can reharvest a strip here and some FUE grafts because we have done a combination technique in previous surgery. We will be again being in the safe donor zone with the strip and the FUE extraction. In spite of we have harvested around 4,000 grafts previously from the safe area. If we compare the same thing by FUE, if we have done FUE in the same area with 4,000 grafts in previous surgery, this donor will not look like this. This will look very much depleted and we can never ever harvest again 3,000-4,000 grafts from the safe area because the density will further go down and it will look very much depleted. This was your second transplant after 2 years. We improved the density in this session in frontal area. We covered your mid scalp and up to the vertex. We did both side temporal triangle reconstruction with single hair thinner grafts, and this is the back side which we can see. We covered up to the vertex area properly, so your vertex and mid scalp will be covered now. So we see the back side, the donor area, there is no two scar. We have converted both the strip into single scar, so there will be a linear line again. There won't be two scars even after harvest of 2 strips, and there is limited FUE harvest from the limited safest zone. And body hair, in spite that we have already harvested around 4,000 grafts from the safe area previously. So from a limited zone we can harvest maximum number of grafts by combination of strip and FUE, which is not possible if we do only FUE technique. If we do only FUE technique from this safe donor zone, in just 4,000 graft extraction, it will become very sparse. Or either we have to go on the unsafe zone like higher vertex zone or the nape of the neck to harvest more grafts. So the best technique to harvest maximum number of grafts from safest area is a combination technique. For example, in this case, we have harvested almost 7,500 grafts from the safest zone without much of the complications of scarring. Whenever there is a higher grade of baldness and we are in the need of more grafts, FUT, FUE and body hair, this is the combination technique which gives the maximum number of grafts to cover larger areas and multiple sessions.
Comfortable, there is no pain whatsoever. In fact, there was no pain even when the surgery was going on. And today also, the second day of surgery, there is no pain at all. I have already got my head wash done and dressing has been done, and I'm sitting perfectly. I had my meal, my breakfast. I'm fit and fine.